Hey campers! It is Thursday, it is 7, and I am extremely excited to introduce to you two of the CAM team. The CAM team is actually quite huge. Most of us have never met each other. We all work remotely, but I'd really like you to meet the lovely Robyn and the lovely Kirsty, who are here tonight to talk about what benefit a nurse can bring to you managing your dog. So, Robyn, tell us a bit about yourself and then hand over to Kirsty to tell us about herself.
Of course. So obviously I'm Robyn. I've been working for CAM for a short while now, just writing blogs, but I've been in practice since 2016 qualified, but been in working and learning about practice since 2008. So I'm quite passionate, get very fiery about things, and obviously osteoarthritis is one of those things that I really enjoy. So obviously we complement each other very well, hopefully.
Perfect. And Kirsty?
Hi, yes. I've been qualified since 1991, so a bit of a dinosaur in the profession, I think, but hugely passionate about senior dogs and the management of senior dogs, and really wanted for a very long time to see what more we can do to help them. And been with CAM as a volunteer for about 3 years, I think now, coming up for 3 years.
So all of you people that are really new to CAM's been around for quite a while. We've been just slowly growing. We're having a really good exponential growth now, which is fantastic. It's making us very happy. I think we had nearly 200 people join us yesterday. You know, it was quite crazy on surge of people. So let's crack on. We're going to talk to you about the role of vet nurses. Now, as a vet myself, I really love using my nurses because I can't do the workload on my own. And I want to work with people that get a lot of job satisfaction and get to show the world their skills. So I really love using nurses, and that's what today's about, is giving you, the owner, that faith that that nurse in that practice is going to be giving you gold dust, okay? So first of all, we're just going to talk about nursing qualifications because we want you to understand that these people have got a lot of training behind them. So tell us about yourself, Robyn, and then tell us about yourself, Kirsty, and what the average kind of training is behind becoming a vet nurse.
Oh, okay. I don't know about Kirsty, but I went down the degree route for veterinary nursing. So I did my GCSEs, I did multiple A-levels with the view to go straight into a university. So that takes 3 years. You've got 2 years in university and then a year in practice. As part of getting accepted onto the course, you have to have done a minimum amount of volunteering.
Yeah.
At some, veterinary practices, things like that. So that's obviously showing that you've got the dedication already there. And then once you've qualified, obviously we still have to do continued professional development.
Right.
Very important, obviously, keeping our knowledge up to date in fields that we're interested in. And obviously I started my Advanced Diploma in 2018, which is another 2.5 years of training to become advanced.
Yes.
Yeah. And then you, Kirsty, how did you kind of get into it?
So the route when I came into the profession was slightly different. I did GCSEs, I did A-levels, and then sort of when I went through the process, you started in practice on a practical level. So I did 18 months in practice. We had certain criteria we had to meet and be signed off. We worked under our head nurses under their sort of practice and got a vast array of experience that way. And I worked in a mixed practice to start with, so large and small animal. And then I went to Bristol Veterinary School, Langford. We were the first ever course to go through, nursing course to go through, which was really quite pioneering. And it was, we worked alongside the vet students for, I was there for a year and then graduated from there, went into practice and have continued with education ever since. I've done a degree in sort of wildlife conservation and environmental studies. I volunteered in a zoo environment for 11 years to get sort of experience with the animals as well as being in practice. And so I think the message is the education never stops. It's ongoing.
Yeah.
We have.
So what's their CPD requirements now? So I really want the public to realise that you guys milling around in the background are so qualified to be helping the public. So what are your requirements now as qualified nurses? What do you legally have to do?
I'll jump in on this because it literally changed 3 days ago, the way that we do it for Royal College. We've got a new portal, we've got a new way of doing and registering and logging our CPD. So if we go to an event, if we do some specific learning, we have to log it with the Royal College of Veterinary Surgeons, and we also have to reflect on that learning. And the requirement at the moment is 15 hours a year, but that is the absolute minimum.
And I don't actually know anybody that does that little amount, you know, because
I think mine's about 150 at the moment.
Exactly. Even just today, I've probably spent an hour reading in 10-minute snippets, 20 minutes, you know, checking online. We're always updating ourselves. So that's cool. Hopefully the public have a better understanding of how qualified you guys are. So a lot of people come in quite young into the vet nursing industry, but it's hard graft, isn't it? So this is my opportunity to just let the public know it ain't plain sailing being a vet nurse. Just give us a bit of a background. You're allowed to kind of wave your flags of how different it is.
I'll so obviously it's quite an interesting one, the degree route that I did. So obviously you're expected in university, you do assignments, you do written assignments, you do examinations and practical examinations. During your year out and your blocks in the practice, you do similar to what Kirsty mentioned, not quite the portfolio side of things, like we called it NPL, Nursing Progress Log, where we had to sign off on certain competencies, ranging from, you know, simple things like drawing up a drug to more advanced things. And obviously we had to log a certain amount of hours per week, which the minimum was 35 hours per week.
Yeah, so it's hard graft, isn't it? Yeah. And would you say that you guys get recognised enough? I'm playing a game here. I know I'm trying to sing your praises because I've worked with such amazing nurses through my 19-year career. And I can remember if it wasn't for the nurses, I don't think I'd still be here. They held my hand, you know, really late at night when we were trying to deal with road traffic accidents and I was a bit out of my depth.
Yeah.
They are fantastic people. So hands up, brilliant, well done, you nurses. That's really that section done. We're now going to go on to what you can do for OA. So let's start off with skill bases that nurses have and are currently being used. And there's something that is quite prevalent around the UK is weight clinics. Who wants to start?
I don't know. I don't mind starting.
Okay, you start.
Okay. So yeah, I mean, obviously we all know that weight clinics are massively important, not just to osteoarthritis, but a whole host of other issues going on. So I always try and be quite firm that if we do see an overweight dog, whether it's just for a flea and worm treatment, you know, don't brush it under the carpet just because we think it's going to be a difficult conversation. It's something that we definitely can pick up. And for owners out there who are watching, you know, if a nurse makes a comment, don't be offended, because we truly have got your animal's interest at heart. So, you know, although it might be a bit of a shock to you, you didn't expect them to, you know, you've been in for a flea and worm treatment, you didn't expect them to say that there's a bit of extra weight there. Don't be offended, try and take on what they're saying, because there's a whole host of things that we can help you with in terms of losing weight. We're not going to, you know, force you into a prescription diet that you don't want. We're going to look holistically at absolutely hopefully we'll be looking holistically at diet, exercise, treats. Are they getting your breakfast with you? Are they getting a bit of your tea with you?
Do you know what? I had a guy just after Christmas. I'd set him the task to get his dog to lose weight. His dog was about 40 odd kilos. He came back in January. He'd lost 4 kilos. How the heck did you stopped buying him takeaways? And I was like, oh my God. So tell us what kind of things happen in a weight clinic. You guys are on, you know, the ground. Are they quite well established in most practices in the UK now?
I think so. I think
Yeah.
more so. They're becoming more and more prevalent in practices, and more sort of people. I think owners are expecting it as well. Owners are taking. I see owners taking their dog in as they're walking past to weigh their dog, which is really positive. They just pop in, weigh their dog, pop out, which is great. But I think I'm seeing more and more weight clinics, and more of those conversations are definitely happening.
Yeah,
Amazing.
definitely.
So what can an owner expect? So Robyn, what can an owner expect in a weight clinic? Like, let's just cross compare what you guys are up to. Let's stay here for about 10 minutes maximum, because we've got a lot more to cover. But what sorts of things, if they were to go to their clinic tomorrow and say, I've heard from the amazing Cam that you are likely to do a weight clinic. I know there's a chance my dog's overweight. I don't want them to be, so how can you help me?
Oh, so if you're with me, you're probably stuck with me for a long time. But
That's good.
but no, it's quite good now. We've got a lot of tools to help us assess dogs now. So can you see that?
Yes.
Yep. So
Well
we've
done.
got a 9-point body condition score. That really, really helps us narrow it down. And I also wanted to highlight that we can help you work out a very rough ideal body weight. So you should always be feeding for the ideal weight that your dog should be, never what it is currently. And that's a mistake that a lot of people sort of, fall the trap that people fall into. They've got a 30-kilo dog, they feed it for a 30-kilo dog, when actually it should be more like 25. And there's a pretty simple calculation that we can do to help you with that. We'll assess your diet that you're on. So we, bring the bag of food in. We can look at the back, we can look at the contents, we can help you out with that. Exercise, we can look at treats, we can look at areas that we need to focus on in terms of musculature and fat loss. We can, we can tape measure them. There's loads.
I think that's really important. I think people have a preconception they're going to come in, be put on a weighing scales, and the nurse is going to tell them off. And it's so far from the truth. I think, just to recount a story, I spent some time with an owner in a weight clinic. The nurse was off sick, so I did it. And about 25 minutes into this weight clinic, I finally got the little gem. And I'd been looking at the dog, and I looked at his teeth and went, your dog's teeth are really clean for like an 8-year-old Labrador. What are you feeding? And they're like, oh, he gets a bone, he gets about 4 dentist sticks, and I'm like, that's food. And they're like, no, it's teeth cleaning, that's not food.
Yeah.
So, I mean, it's a lot of detective work, isn't there?
Yeah, if I can just jump in on that, because I find it's really useful to ask an owner to keep a food diary. I love diaries, whether it be mobility, weight, food. But a food diary I found is so telling. They're like, I don't feed my dog very much. He doesn't get this, he doesn't get that. But when they start to write it down, they have that moment of realization that actually, there's a little bit more going to my dog each day than I thought. And it's something that they take control of. They keep the diary, they bring it back. And I think it's really helpful.
I think that's really helpful. Just as a total tangent, but it's worth saying, we did this a few months ago on one of the Facebook posts, and we asked people to tell us what they spend on their dog each month. And it was fascinating. And there was a couple of comments where one person went, I can't tell my husband. And I said, actually, I spend more money on treats than I do at the vet. I didn't realise, Other people made them look at their supplements. They realised they were feeding the same kind of supplement, but different packaging. It was really fascinating. So what a clinic does gives you time, isn't it?
Yeah.
And what is the length of an average weight clinic with a nurse, would you say?
I think it's very dependent. I usually try and start at half an hour, only because of the huge amount of detective work. But as Kirsty said to me when I've talked to her previously, a lot of information leaves the client as you go out that consult room, 80%. So I try and utilize visual aids, writing things down, getting them involved in the body condition score, just so that, and that can, so that's half an hour, and then it depends on the client afterwards, but 20 minutes, at least, really.
I mean, I follow up clients with an email. I'll follow up a consultation, send them an email, a sheet, direct them on to maybe Cam website or somewhere, but just to touch base with them, just remind them that, you know, actually they've been in some of the information, because like Robyn said, they don't retain most of what you've said. They can't. And I think the study came from the human model in a doctor's surgery, 20-30 minutes after leaving surgery, that, you know, most of that information is gone. And it's the same for all. If we can follow up and we can just touch base with them in between. And I found if they've got a named nurse or a nurse contact at the practice, so they see the same nurse each time, if possible, they build up that trust and that relationship. That's really beneficial, because then they start to open up and tell you things, and that enables you to delve a bit deeper and, you know, and find out why, you know, the dog's having 4 dentist a day, what, you know. And often the owners love to give their dogs treats, don't they, because the dog reacts positively, and it's just breaking things down, isn't it? So
but I think you're right. The relationship's really good, and I'm the more I get to know an owner, the more cheeky I get to be, and the more there's a little bit of humour, and as you say, the barriers drop, and also they feel that they need to try. They want to please me. That's a horrible thing to say. They want to impress me, is probably the right word. And there's a lot more effort. So Weight Watchers in women, you know, there's a bit of peer pressure, isn't there? You're going to see the same people next week. Is the weight going to have gone, you know? So you do in nurse clinics get the chance to see the same person.
Yeah, I think that's really important as well for measurements. Because everyone does measurements at different places, although you try and do like neck, chest, abdomen, but everyone has their little knack of where they do it. And if you're swapping between nurses all the time, you might be getting a lot of fluctuations in those measurements as well.
Yeah. So also other things that I've seen, you guys get to be a bit imaginative. You do things like weight loss clubs, and have you had any experience of that sort of thing?
So I have. I've done. Yeah, I'll just jump in. I've done weight loss classes where, you know, like puppy classes, but for dogs and for owners. Actually, owners draw support of each other as well.
Yeah.
And it doesn't have a competition. That's not how I certainly see it. But owners, you know, come back and they share their stories and they share their successes. Have you, you know, I found this treat that's based on fruit and it's really low calories, and just tried it and things like that. The information gets shared around in these sort of environments, I think, is really beneficial.
Yeah, I think so too. There was talk about like weight loss clubs, as you say, and it drives each other, and you also get to cross compare body condition scores. So you'll be able to, as a team, learn and look at different breeds, different sized dogs, which is quite handy. There is a big fear, and I think Robyn touched on it very, very well earlier, that if you go to one of these clinics, you're going to be forced to purchase the food that the clinic wants to sell. Is that true?
I mean, I would say it depends on the clinic that you go to on you know on whether they charge, whether they don't, whether they refer. Personally, I don't push into a certain food. I try and work with what they've got, or brands that I am happy with as well. And basically try and work out the best thing for that owner, because, you know, one size doesn't fit all. And you can't, I said to Kirsty, you know, you can't go from someone who's fed a certain way and completely flip that and, you know, go to something totally different, because it just won't work. They won't stick to it. And it will be really, really difficult for the dog and the owner. And it'll just force some people to drop out. So working alongside, you know, different brands, different types of foods, different, you know, whatevers, is the way to go forward, really.
Perfect. Okay, so we've kind of touched on weight clinic, and that's great. So we know that most practices around the UK can offer that. The owner is going to arrive, they're going to be greeted, they're going to probably have the same person who's infused and has got more time and is going to do body condition scoring and measuring and weighing and loads of advice, and they're not going to be forced to buy a food that they don't necessarily want to purchase. Brilliant, we're happy. What other clinics do you guys run? Do you do senior clinics?
Yeah, absolutely. Senior clinics and linking into mobility clinics, I think they very much go sort of together. And if you're doing a senior clinic, you're going to touch on so many things within that as well. Weight would come into that as well. nutrition, mobility, movement. So senior clinics are so broad in their sort of, what we can offer, but we can certainly tailor them down to individual dogs, to meet owners' expectations, what your dog actually needs, and tailor that clinic specifically to individual dogs. So I find that senior clinics need more time. We need to start slowly, particularly if an owner's coming to us from diagnosis from a vet. So they might have literally come out of one door and the vet said, can you have a chat with this owner? I think we have to go slowly. We have to drip feed the information in, because we have to understand that owners of senior dogs, particularly if they've had a diagnosis, they've got a condition, the owners are going through an emotional process as well with their dog. So we're supporting the dog, but we're supporting the owner at the same time.
So Robyn, what sort of things, if somebody was to approach their clinic tomorrow and say, listen to this amazing Facebook Live, and these people suggested that you might offer a senior clinic service, or what kind of things would you be covering? Let's just throw a few ideas out there.
Yeah, well, there's a lot of variation. So different clinics run it differently depending on, like you said, referral from a vet or does someone come in. Usually we do like a basic blood test alongside maybe urinalysis. So we're testing our liver function, kidney function, maybe checking our urine for any signs of anything that's concerning, really. From that, the nurse can basically check with the vet. Do we have any concerns about this dog? Are we diabetic? Are we osteoarthritic? Have we got any pain signals? Are we showing any other signs of general geriatric illnesses? And basically working, really important, but working as a team. And once the vet has made the diagnosis, obviously that nurses can't diagnose, but once the vet has made the diagnosis, the nurse can support that particular, or maybe a few particular issues that we've picked up. So, have we picked up osteoarthritis? Have we picked up the potential of early renal disease? Do we need to start making changes to our home life, to our diet, to our water intake, and basically making improvements to help slow degeneration of those illnesses?
Can you add anything to that, Kirsty? Other things that nurses might be able to contribute during these senior clinics?
So we're certainly going to look at dental and teeth. We're going to do general body condition. We're going to we'll talk to the owners. I think that's really valuable, is actually getting the owners, get that information from them, extracting it from them, because they know their dog best. So I'm going to be asking them, what's the dog like at home? Is it showing any signs of cognitive dysfunction? Is the dog's sleep pattern changing? The way it moves? Can it still shake? Can it roll? What's it toileting like? All of those sort of questions that take time to extract the information, but actually give us a wealth of information and build a picture about that dog's general health status and how it's coping at home.
Yeah. And I think you both have touched on a point that again needs to be made. You have time. So for the CAM followers to understand, this is the general way it works in the UK, and I've been a bit flitty in my career, and I've worked in quite a few places, but we won't talk about that. Most clinics are 10 to 15 minutes with the vet. And that is the way it is. It's run on, believe it or not, an ophthalmological, so eye consult system type approach, which are quite quick. You go in, get your eyes tested, diagnosis out. We hopefully will change over the next decade, maybe, to give more time with vet and owner, but we're still stuck with this 10 to 15 minutes. Whereas the nurses and these nurse clinics do seem to have more time. And I think the average nurse clinic, no matter what it is generally about half an hour upwards. Some clinics will even give nurses the opportunity to spend an hour with a client. So time is so important, because you get more chance to listen. Yeah. And we've talked about this earlier. There's lots of evidence that lovely female nurses are much more likely to listen and extract lovely gems of important information than vets like myself, especially if I was male. So we know nurses are great at this. They have more time to spend with you. Let's now just jump to a few things that owners might ask. Cost. What's going on in that world at the moment? Because there's different schools of thought on cost.
Yeah, I'll let Kirsty mainly cover because she does a lot of very advanced clinics. But I would say it really, really does depend on the clinic. So whether they have, arthritis clinics or senior clinics, we should be charging for the nurses' time as professionals. And I'm hoping that the general public will start to understand that and value that. Because at the end of the day, we are very highly trained professionals and we should be utilising our skills more thoroughly.
Agree. Kirsty, what have you experienced with regards to costs?
So I'm quite fortunate in a way that I work in the practices. Either I go in to see a patient or I might locum there. And there's a huge diversity. So a lot of these practices now are offering healthy pet clubs. And as part of the healthy pet clubs, the owner pays an amount each month, and that gives them so many vet checks a year. It gives them their flea, their worming, that's all included. Nurse clinics or senior clinics can be included in that. Although I wouldn't expect an hour clinic to be part of that. I would like an hour as a senior clinic, particularly for the first one, so that I can get all the information I need. There's a huge, huge diversity in charges. I can't even say it's standard. Some practices aren't charging. Some are charging a set fee for a nurse clinic. So it's really down to individual practices, and I can't say that there is one size fits all for this.
No, I think there definitely in the last few years has been a move to start charging for them so that people respect them. I know countless nurses who would have been doing a free of charge clinic to try and be supportive to the local community, and people would just not turn up, come in late. They really didn't value them, but the charges do tend to be a lot more cost effective. So you're likely to get more time for less money. So
particularly with the senior clinics, like I said before, like the urinalysis and the sort of the first port of call in terms of the diagnostics, they usually do like a discount price on that. To sort of help that.
So Patricia, you asked how much do these clinics cost and can they be claimed for insurance? I'm pretty sure you can claim them on your insurance, but you would have to check in with your insurance company and just double check that. Hey Lee, nice that you arrived late again. Anyway, so let's move on. Let's talk about our daydreams. Okay, so we love managing arthritis. That's why these guys volunteer for us. Just so you guys know, CAM is a self-funded organisation. We're looking into trying to get a charity status. It's not that easy. We fund ourselves by selling booklets. We're going to talk about these in a minute. We do the owner workshop. We do practice consultancy. We do industry consultancy. We do lots and lots of fundraising to try and keep this platform going. So a lot of us are actually just doing it out of the kindness of our own hearts. So thank you, you guys. Thank you for being here. Thank you very much for your time. But we are here because we really care about improving the management of OA cases. So let's daydream about an OA clinic. If we all could just throw in our ideas of what we would like to do in an OA clinic. Let's go for it. Kirsty, you go first.
So I would love to do everything. And I think that's the biggest message is we can't do everything all at once. I would love to talk to an owner about, we've gone weight, we've done nutrition, movement, gait. What is the house like at home? How's your dog navigating and coping in its home environment? What's your dog doing on its exercise? Are you using a ball launcher? How's the dog getting in and out of a car? Everything to do with that dog's life is relevant when it becomes a senior dog. And also we have to think about sort of comorbidities, other illnesses that are running alongside the arthritis that have to be managed as well. But I think the biggest thing, in the daydream is actually stripping it back to basics to start with. We've got to get the owner in, we've got to get them interested, and we've got to start one thing at a time and build up slowly. If we do everything all at once, how do we know what's working? How do we know what isn't working? And I think that's the biggest thing for me is stopping myself. You want to give them everything all at once because you want to make that dog's life better, but actually we need to step back. We need to be restrained, and we need to sort of do the important things first and one thing at a time.
Yeah.
Yeah. So what about you, Robyn? What kind of things? And then we'll go for a list of bits and bobs. But what's important to you in this OA clinic?
Yeah, I mean, I think I'd have to agree with Kirsty in that when I sort of do an osteoarthritis clinic, I really start with a very basic model of what I ask. And like you said, if you keep on seeing the same nurse, you start to learn about the owner, you start to learn about the dog, you start to really care about all aspects of their life. You start to be able to delve a little bit deeper into their home life, into their exercise. But my very first ones are just, bish, bash, bosh. What are your exercise? Where is the pain? When are we the most stiff? Are we stiff in the morning, at night? What's it following? Is there any behaviour changes? Things like that are really important just to get a very basic understanding of that dog. And then from there, it's very easy to highlight where our areas that we need to delve a little bit deeper are. And then that's where you focus on.
Yeah, I think a way that's really good. So any nurses that are following this and going, oh, I really want to do an OA clinic. I really want to, demonstrate my skill base, but actually there's so much to cover. And you're right, Kirsty. I started CAM years ago thinking, it's all right, I can be good at one thing, that's fine. And I'm like, oh my God, it's huge. All the interventions that you can do for arthritis.
Yeah.
It's obscene.
Yeah.
And you can swamp people. So my aim when I do an OA consultation is very simple, 3 squares. So cube, and a cube and above. And the cube on the lower left is basically controlling pain, because we know if there is pain there, we're not going to get the best for that dog with other therapies, exercise, quality of life's affected, other conditions can be induced because of uncontrolled pain. So one really, really important thing for me is being able to assess pain, work with the owner to assess pain, get them to be objective about pain so that we can make sure that we're doing the best to control discomfort so that we have better quality of life, better movement. My next cube along, and the one that I love, minimize further harm. Minimize further harm. Often forgotten, often neglected, because it doesn't involve clever stuff. It's quite simple, it's quite logical. So this is your home management, your lifestyle, you're jumping in and out of your car, the hobbies that you do that are exacerbating it. So I love that cube, but that's quite time consuming. That's why we've written these, all of these things, loads of these. And then my cube above it, so my 3 cubes, my cube above is called rebuild.
Yeah.
And rebuild is both physically, so we're trying to get that dog's mobility back. We're trying to get the muscle mass and function back. We're trying to get those joints stable. We're trying to get that dog's quality of life back. But we're also trying to make sure we rebuild that relationship with you, the owner, because all of us get a dog for a reason. And, I have Luna because I want to hike and I want to paddleboard and I want to run and I want to do all these activities. And when somebody comes in and says, nah, the body says no, what can I do instead with that dog to maintain that relationship? So that's the way that my head runs the clinics. I keep it really, really simple. And then I allow them to sprout, and things sprout with time. What kind of things would you have to hand in your consults? What kind of things are you doing? I'm putting you a bit on the spot now.
Kirsty has some amazing things that are her personal over the years she's built.
Kirsty, what sort of things do you have to hand in your clinic?
What do I have to hand?
Yeah.
So I have to hand CAM books, and actually I've got them all here. I've got them all here. There's a whole range that you can get online. I have these available. And I think one of the things that goes home, whether I see a patient in my own clinic, whether I see them at home, wherever I see them, they get a good day, bad day sheet. That is the first thing I give them, because it's something that the owner can take away. They can look online, they can see the information that's available, but this is so easy to do. And I also get them to fill in each day, whether the dog's having a good day, whether they're having a bad day, and a little weather symbol, so we can start to build trust. So if we see a dog coming back and there's a patch where maybe they're having a bit of a flare or something happened, maybe the dog tripped or fell, we can start to build a pattern of the dog's life and what's happening. So every person that I see is pointed in the direction of these booklets and the valuable information online that goes with it.
And the good day, bad day diary, for anybody that's watching this from abroad, sorry, I seem to be getting shorter.
I'm thinking down.
Just thinking, it's been a long day. Anybody that's abroad that can't get hold of these booklets, there is the good day, bad day diary on the CAM website. So you go to caninearthritis.co.uk, you go to how can CAM help, and then you go to download and resources. And in there, you will see the good day, bad day diary with loads of other things, including
my home tool is great as well.
Yes, my tool is amazing. That was a lot of hard work from some.
Yeah, that's something that it depends on the client. So you can email that out to a client before they come.
Yeah.
You can do it while you're there, or you can get them to do it and then bring it back. And it is so quick and easy at highlighting the areas within the home that needs adaptations.
Yeah,
and
absolutely.
Really good.
So any nurses that are listening to this, we're there to try and make your life easier. And something that we've definitely found is that you need to give something printed and professional looking for people to believe that it's important.
Yeah.
I know when I just mention things in passing, it kind of goes in one ear and out the other. They don't have the ability to take in all of that information and they let things slip. But by using something that looks so amazing, like just
it's the nurse one.
Exactly, then people have more faith in it that it's important. So please note that.
Yeah.
Okay. So if you could you're setting up an OA clinic tomorrow, Robyn. So you're setting up an OA clinic tomorrow and your boss has said, do whatever you need to do, Robyn. You're allowed. The purse strings. What sort of thing would you like to be doing in your nurse clinics? What things do you do already?
I don't know about the purse strings one, but so yeah, just start with you've got the diagnosis, what medications you're on. Okay. Obviously, nurses can't prescribe certain medications and we can't diagnose, but we can have a very, very in-depth working knowledge of what these drugs do. And we can work perfectly well as a part of a team to discuss if these doses are working and then change, asking the vet basically, do you think this is something that would be beneficial? Behavior wise, like I think one of the main things I wanted to get in this is to say, have you seen this older dog that has never had anal gland issues and then suddenly they're booked in for you 3 weeks in a row for anal glands? Just start to have a little think and think, is it because the squatting position has changed? Have they got hip pain? These things that you need to be flagging up, basically very, very detailed things, but it's just things that
it works both ways. You might have a diagnosis and you think, I need to go and check their personal hygiene, or the personal hygiene might actually help with the diagnosis. I think you
obviously have this and send it home with the owner as well.
Yeah.
And I also like having like some kind of muscle condition score.
Yeah. Well, we've actually got a question, and I don't know if you guys are happy to answer this. What recommendation can you make for weight loss in a dog with sarcopenia? Now, that is quite specific, and I am just kind of being a bit of a bossy vet. Sarcopenia basically is like muscle mass loss, and it tends, I would be wanting to make sure that there's not an underlying reason. So for me, I'd definitely be doing a full clinical exam with a vet, bloods, urinalysis and check that there isn't a health reason that you've got sarcopenia, because you can try as hard as you like to get weight back on or muscle, lean body mass back on. If you've got a clinical issue, we need to address it. But she's saying about weight loss. So this dog's obviously got loss of lean body mass for some reason.
Are we saying like, is it like a cachexia type symptom, or?
I don't know. So sarcopenia is basically talking about lean body loss, but there's also a hell of a lot of weight there. It's kind of that's quite a specific question. And I would probably suggest that you do need to check the cause of the sarcopenia. If you're talking about sarcopenia that's just with aging and there's definitely no underlying health reason, then I personally am not a nutritionist, and I would seek the help of a prescription food company.
Yeah, exactly.
Yeah.
Is that kind of the way that you guys would go, or have you got some gems in there?
I mean, like, you know, I mentioned before about, like, you do see a lot of cachexic animals with just generalized loss of body, you know, just because of, you know, chronic illnesses and things like that. And they are really hard to get a really good musculature on. And I think, you know, like working alongside a nutritionalist, veterinary surgeon, and probably physio to try and protect and enhance. But nutrition wise, you know, nutritionalist.
Yeah,
there's diets out there that will help, but like you say, you have to rule out any underlying medical causes first. And there's a variety of diets that are professing to help build lean muscle mass, but I think it is the remit of a specialized nutritionist.
Yeah. And I think I love the fact, Robyn, that you mentioned the multidisciplinary team. I'm quite lucky where I work because we have things like underwater treadmill, so we would be able to be supporting the soft tissues of this dog and maintaining them and hopefully building them whilst trying to get weight off, but doing it in a more physical fashion than thinking that a diet was going to do it for us. But my little take home for you, Kirsten True, is please just make sure that there isn't an underlying reason that you're losing that lean body mass. For example, let me just give you an example. My dog, when she was older, she actually had anemia. So she was quite old, she was 15. And that really did have a massive influence on her energy levels. And then her energy levels lacked, so she didn't exercise so much. So then she started losing lean body mass because of that reason. So doing a blood sample and a urine test is a really good idea. We've had somebody say, oh my God, the anal gland issue came up with my bulldog after being fine for 9 years and now has it. Good point how that can occur. Well done, Robyn. Mention. What kind of things in a clinic? Because I'm going to inspire you. Obviously, there's the booklets. Obviously, there's the anti-slip tape, which has its role. This. Obviously, there's the bandanas, and all of this is obvious to us. But in a clinic situation, I would like to be able to give that dog and that owner some kind of therapy, some kind of input. And me and Kirsty both do massage, both love massage. I know that a lot of clinics around the country now, the nurses are becoming more equipped with, say, physio, with, say, massage, or they might invest in, say, laser, pulse electromagnetic field therapy. Is that quite common? Do you experience that?
Yes, in certain practices, certainly promoting these therapies quite broadly now. Some practices aren't quite there yet. Maybe they're still developing their clinics, or they have different ways of working. But I'm finding more and more clinics are offering more services, and you can incorporate laser or massage myotherapy into a clinic, into the time. You know, if you've got an hour, you've got that opportunity to do. I mean, laser doesn't take long, so you can, you know, depending on how many joints you're targeting, you could easily fit a laser session into a senior clinic with an owner and their dog, and you know that would all happen within that one visit. So you know, that's entirely possible. And I think the owners are becoming more aware of what's available, and they're going into their vets and asking for it. And I think that's where it's starting to turn the tide.
Yeah. We went to a fantastic practice, well, 2 fantastic practices actually this weekend. We went to Orchard in Birmingham, and they're just moving premises, and they're getting a hydrotherapy suite, and they've got an in-house physiotherapist, and they're just getting busier and busier and busier because they're offering that service. And then we actually drove in Swindon, which is quite a multi-branch practice with a huge hospital, and they too are beginning to offer more of this physio. So please do ask your practices whether they offer more.
Yeah, and I think I'd say as well, if the practice doesn't, it's a smaller branch, whatever, they usually do have a trusted, local hydrotherapy or a trusted physio. So they're not afraid to delegate. If they don't have the services, they'll probably know of someone who does, basically.
Yeah, that's a really good point. We kind of hope that practices will have that notice board or that directory to help you guys select someone that they trust. So what other stuff do we, because we've bigged up nurses, we've talked about their qualifications, we've told how they're underutilised, they just don't get the limelight that they need and they deserve. We've talked about weight clinics, we talked about senior clinics, we've jumped into mobility clinics. Is there more that the public need to know about how important nurses are and what they can offer? Is there anything else that we can add?
Go on,
Yes.
Kirsty,
Go on, Robyn, you go.
Probably a whole list. Oh, it's really hard to know, really. I know Kirsty can offer home visits, which I think she's definitely one to talk about the things that can be done. It's depending on rota, amount of nurses, size of practice, something that they can be looking into and working towards if it's a possibility, really.
Yeah, I think I'm going to let Kirsty talk about mobile, but something that I've heard of some practices doing now is that nurses are put on the rota to be the phone people. So telehealth is a really big thing now, guys. So we don't say telemedicine because medicine almost implies that you're diagnosing by phone. Telehealth is much more a generalist service. And Kirsty, you've got experience of both. So let's start with telehealth.
Yes.
To mobile. So what do I mean by telehealth that a practice might be able to offer?
So I'm a head nurse in a telehealth veterinary business. That they can offer a lot. So a qualified veterinary nurse can first of all triage your pet over the phone. So we can do emergency triage. If we're talking more general, they can talk through the issues with you over the phone. Some people are even offering video consults. That's emerging, and I think that's the demand that's coming from the public, that they get home late at night, maybe 8 o'clock in the evening, they want to speak to their veterinary professional, they want a video call or they want a phone call. So the qualified veterinary nurses, since I started 20 whatever years ago, would take the phones in the evenings. So basically they would triage then. They would pick up the phone, they would speak to the client, they would make that decision and then pass it on to the duty vet. So that's been happening for a long time. But I think what's changing is the services that we can provide within the remit of telehealth. So you could do a senior consult with an owner over the phone. I get all of my patients I love mobility diaries, and I mean a video diary. So I get them to slow-mo video their dog moving in a walk. They can email that to me, and then I can chat over the phone about what we're seeing, what the owner's experiencing. So I think it doesn't necessarily have to be that you go to the clinic every single time with your dog. And if you've got a really old dog, or you've got a dog that doesn't do well in the car, or they're really stiff after being in the car, or the dog's really nervous coming to the clinic and doesn't like being there, so doesn't behave naturally, they just sit there either really rigid or they're jumping around trying to get biscuits from reception, you don't get that true reflection. By communicating with the owner in a different way, you can still provide a valuable service to that owner. It's still going to achieve what the owner wants. They still have to come to clinic sometimes, but we're bridging those gaps in between.
Yeah.
And I think people need to know that there is that. It's really growing. It's really topical. It's always in the veterinary press about where are we at with telehealth. Very much about diagnosis and prescription. These are big topics that Can you imagine if we diagnosed something by phone and we got it wrong?
Yeah, well, we don't diagnose. So in a way, it's slightly easier for nurses than vets because we never diagnose. So we're not going to go down that route of diagnosing. Probably a bit easier for a vet.
Yeah, no, absolutely. But it is a very big topic at the moment, CAM followers. There's lots of movement in this area. There's a big corporate that now offers telehealth as kind of like a first line almost to filter out what needs consults and what doesn't. So do ask if it's available. Let's jump on to mobility, your mobile service. We've both played this game. I've loved my mobile service. So I'm sad to see it go, actually. But what do you do?
What do I do? So I will see patients under veterinary referral in their home environment. Mm-hmm. So my average consult will be about an hour to an hour and a half, which is, it is a luxury. I do admit it's a luxury to be able to spend that amount of time. But I will, from the minute I ring the doorbell in that house, I'm assessing that animal, that dog. Does the dog come and greet me? How does it greet me? How is it moving? How does it navigate around its home environment? Is it hesitating? Is it slipping? So, I literally can go to a home and spend an hour and a half with an owner and build up a huge picture of that animal's lifestyle, how it's coping on a daily basis, how the owner's coping with their pet as well, because that's hugely important to support the owner through this. It's a journey. Arthritis is a journey. We can't cure it. We can slow down progression, but it's a journey for the owner as well as the pet. Yeah. And I think it's massively important that we recognise that and we're able to support both to get the outcomes that we want and the owner wants. So I will do basically a nurse clinic, but in a home environment. So if I don't have access to scales, I will use a tape measure and I will weigh. I will measure, like we talked about before, sort of waist, neck, chest. That's a good way for me to evaluate each time I go back. And for those dogs that aren't transportable easily, it means they can still get that care, but it's in their home environment.
Yeah, and I think CAM followers ask if your practices do that. So it's kind of one of those things. I see them more frequently now. You see logoed up vans and you get the impression that practice is offering a more mobile service. And any practice managers or vets or vet nurses that are listening to this, if you don't, maybe it's a good thing to start doing. For me, it gave me a lot of personal satisfaction. It was a really steep learning curve. Yeah. It really it taught me a lot, and what I learned in my mobile service I now can incorporate in my in-house service and vice versa. And so I do really suggest that practices look into doing that. So we've been talking for about 52 minutes. We've got 10 top tips to do. Is there anything more that you want us to talk about before we go into juicy, we're giving gifts tips?
I just want to say, use your veterinary nurse. Use them to their full ability. They've trained hard. They've trained for a long time. They're highly skilled professionals. Use them. And, practices are getting better at utilising their nurses within practice. Owners need to realise they're a resource that they can use as well.
Yeah, perfect. Robyn, anything to add before we do 10 top tips?
No, I think we've covered most things. There's just for maybe the nurses out there, if you're not feeling confident with the consultations, just get yourself practicing, get very basic, make yourself look at load score, look at how to muscle score, look at how to body condition score, look at the meds that you might be expecting to come across, and get yourself just a little bit more knowledgeable, and then just start with the bonded clients, start with the ones that you can trust, and get yourself doing it.
Let me just put this cup over the plug hole, like we're emptying the hydro tank, and it now sounds like I've got flatulence in here. Let me just go and put this over. Maybe that's just a little bit better. Suddenly sound like I'm in the gents' loo. I'm not in the gents' loo, but we're emptying our hydro tank at the end of the day, and it's creating quite a nice noise. Okay, so let's crack on. So these are going to be 10 gifts. They're not tips, they're gifts. And I'm going to start with Kirsty. Number 10, something that you feel that any owner of any dog, no matter what money they have, physical capabilities, where in the world they are, what gift can you give which you feel is essential that owners know and can implement? Number 10.
I would go with the one that seems to come up every week and we've talked about extensively is weight management, I'm going to call it. The gift of that is it doesn't need to cost anything.
Absolutely.
It's free.
Save your money.
It's free. Yeah, absolutely. And it empowers the owner to take control over their dog's life. And I think they actively feel like they're doing something. Once they get on board with it, they're actively helping their dog every day at home. They're in control of their dog's future. And I think that's hugely powerful as well.
So, okay, you've mentioned it to them. Now help that owner who's watching this, who's never really thought about it, never really kind of realised the importance. What's the first thing that they could do as soon as we stop this Facebook Live?
Start a food diary. Be honest with themselves. Start a food diary, and then they've got something to take with them and discuss.
Perfect. Okay, number 9, Robyn. Think of it as a gift.
A gift. Well, okay, I'll go on from this weight management thing. Obviously, Cam has been doing the body condition scores free of charge. Have a little go at it yourself at home. Try and download one of these and see what you think is going on.
Yeah.
And then there is a calculation that you can do, and it's really, really easy, but you can watch this again. If you are a 6 body condition score, divide by 1.1, that's giving you an ideal body weight. If it's a 7, 1.2, 8, 1.3, 9, 1.4, and just try and get a little bit of an idea about what your dog's ideal body weight should be. And then if you feel that you're not doing it right, you're being a little bit kind to those, bits of fat that you're prodding a bit too hard.
Jab handles.
Yeah, I call them love handles. Go into your vet nurse and say, this is what I think my dog is, and then see if you're right, and then you've got an idea basically then of what your ideal body weight should be.
Perfect. And just to make sure that you never feel guilty, this is a really, really big problem in the pet owning world. I think it's 60, maybe 67% of owners have overweight dogs and cats. So if you do discover that your dog is carrying excess weight, don't beat yourself up. You're in the majority, but please take this opportunity with fresh eyes to critique your dog. I see 4 out of 5 dogs I see are overweight, and most owners don't realise the importance or can't see it. Okay, number 7 from me is I'm going to add to the weight yet again. We offer a visual body condition score in Holly's Army for you guys. The lovely Lindsay, who is also a vet nurse and another CAM volunteer, will look at photos of your dog. You need to take a photo from above, directly looking down. So head and bottom, look directly down, and directly from the side, exactly as that picture. And Lindsay will do her damnedest to help you and get you on the right path. So if we've got any people that are in the darkest depths of Canada, or they're sat over there somewhere in India, if you're watching this and you go, oh, I don't have access to those resources, join Holly's Army and ask for a body condition score. Lindsay will be able to do it for you. So Lindsay, you can get her on info@caninearthritis.co.uk. If you go and introduce yourself on Holly's Army, the lovely Lynn, who is already here, will certainly put you in the right direction. So that's gift number 3. I think we've done weight now. Let's move on. Kirsty, gift number 4.
So I'm going to link on to Holly's Army, and I think the biggest gift an owner can give themselves when they've had a diagnosis or they're on this arthritic journey is to join a group like Holly's Army. It's a non-threatening environment where owners support other owners, they share tips, they support each other, and I think that's a hugely valuable part of managing this condition.
Perfect. I like it, because I think it does get neglected, the owner side of things. I think we all hanker down on the dog and we often don't look at the owner. And I can prove that this week when I was with Danny and we were doing a little chat about caregiver placebo, caregiver burden, when we were filming for YouTube, we both nearly got to the point that we had to stop filming because it's so powerful. And I lost Holly good 14 months ago now. Well, you lost Sam recently, didn't you?
August.
Yeah. And it's still raw.
Yeah. I think it always stays that way, but I think the more you talk about it, I mean, we haven't really touched on it, but anticipatory grief, I think from the minute owners get a diagnosis, they are on that emotional journey, and without even maybe consciously realizing, they're thinking about the end, and the end may be years away, and that takes a huge toll on the owner if subconsciously they're worrying every time they leave the house, every time they go to the park. And to be part of a group like Holly's Army, where you can get support and you can reach out, you're not on your own. No. And I think you can't put a price on that. It's absolutely invaluable.
No, it's totally true. And I think there's many crap things about social media. We've got some real issues with social media nowadays. But I think it's one of those beautiful things that you know that people are not going to judge you. And I know that sometimes people won't tell me that they're struggling because they think I might judge them as the vet because my interest is their dog. No, that's farthest from the truth. But if you do need to have that kind of distant platform with people that'll get it, that's a good place to go. Come on, Robyn, number 5, gift number 5.
So I think from perspective of an arthritic dog and also an overweight dog, but both use, they don't have to be expensive, licky mats, slow feeders, scatter feeding, scent games. If you've got an arthritic dog and you're thinking, geez, it's icy out there, they're going to slip, they're going to fall, they're going to hurt themselves, just utilize different things to get them moving. And they don't have to be expensive. You can literally hide the breakfast around the house, and it gets them moving, it gets them using their mind, it gets them using their body, trying to engage all the joints, all the muscles, and the mind at the same time.
I love that. At the moment, Luna, who's only 1, has this cardboard box. It's a brew dog. By the way, if anybody knows brew dog, I want to meet them because they've got a dog and they might need us. Anyway, she's got a brew dog box and it's got loads of shredded cardboard and paper. And it's all in there. And then I get some shredded ham and I dump it in there too. And I shake it and then I put it on the floor. And that's her busy for half an hour. And I can make the dinner and I can put my stuff away. And we've used it, about 5 times over the last few days? Yeah, it's going to go in the bin soon.
Yeah.
The pleasure she gets, and think about the happy hormones you get. So brilliant one, Robyn. I love that. It doesn't need to cost any money. If you do want to go and get a few enrichment stuff, support Cam and pop over to the shop because we do some there and all money goes back into Cam. Number 6 for me, it's going to be floors. It's going to be the floors. And I just want to tell you a story about this. Cam Facebook page started in about 2015 because I couldn't believe the amount of people that couldn't see that their dogs were struggling walking on floors in their house. So I started my service like me and Kirsty now run, and I was going to people's houses and repeatedly I was seeing issues, but the owner didn't see it as an issue because they'd lived there for 10 to 15 years. The dog had always kind of coped, so why wouldn't it cope now? By putting these rugs and these anti-slip stuff down, it is amazing. Do you agree, guys? If you the same?
Yeah. Absolutely. Yeah. It's one of the first things that I advise.
Yeah, we've recently had on Holly's Army, it's this dog that's fallen over and slipped and dislocated its hip, and we see loads of dogs who've been hit by another dog that's suddenly so painful. And I think you've got to realise that these micro traumas of slipping, tripping, bumping, they really affect the degeneration of the joint. It's something that's really important to look out for.
Yeah, to be honest, sorry, Hannah, one of my patients, actually, it directly links into that. One of my patients is a senior golden retriever, and she was knocked over in the park by a really friendly puppy who was just bounding up to say hello. 8 months on, the nerve pain and the sciatica in this dog's shoulder was still present.
Yeah.
So, you know, it is about awareness, isn't it? And it's like,
Yeah.
you know, now, you know, this dog wears, you know, it was obvious she was a senior dog. She was on a harness. She has a bandana, you know, but yeah.
Bandana.
They're brilliant for flagging up.
You do number 7 then. Come on, gift the bandana. Tell the world
Gift.
what these are about.
It comes in, is it 2 colours now? It comes in a yellow and a blue.
We're going to expand. We're going to do more colours, but yellow and blue at the moment, but there's going to be more.
So this, yeah, absolutely. This is invaluable. My old boy used to wear one. I think Holly used to wear one when I took him out. And it just is a sign to other owners that actually this dog doesn't want other dogs jumping on them. You know, it's not okay to let your dog go flying up and sort of leaping all around, because actually the ramifications of that can last for months.
Yeah.
Months.
And I think it's sad to see their facial expression. So when Holly would see another dog coming towards her, she would felt like she was backed into a corner, and there'd be no walls, but she was effectively backed into the corner because she couldn't reverse and she couldn't turn sharply. And she couldn't get herself out of that situation. So she effectively had an imaginary wall around her and a dog was coming at her. And it was heartbreaking to see, because just think about it now. I shouldn't say this. I work with Andrew and he primarily scares me at work, and my cortisol levels are always very, very high. And I couldn't imagine being like I do at work all the time. But please think about it. These little additionals can make a big difference. Right, Robyn, number 8.
I think I would say that if you are an owner of an arthritic dog, although vet practices might have slippy floors, that's for hygiene reasons, but they shouldn't be offended if you ask to stay in the car, if you ask for a vet bed to sit on, if you ask for, you know, a rug to be put down. Just ring them before you go in and say, I've got an arthritic dog. Could you please provide us with something to sit on, just to prevent them from tripping over or slipping on that floor? And that could really benefit your veterinary visits as well.
Yeah, and I think the word from Cam is spreading, because I know more and more practices are thinking outside the box on this one. So okay, number 9 for me. There's so much. I get really, really excited because I can't put it all in one. Definitely add a therapist. I spent a good 13 years of my career not realizing the benefit of the multidisciplinary team. And I think if you are seeing a vet and they have a nurse clinic, that's a form of therapist, so go and see them. If not, there might be a physiotherapist they recommend or is in-house. Hydrotherapist might be in-house, might be recommend. Massage therapist, myotherapist, acupuncturist. Go there. Do go there, because it was doing the myotherapy diploma that basically created Cam. I had my eyes opened to a world that I didn't really realize was there, but the difference that adding that therapy into your treatment protocol can be amazing, amazing. So as a therapist. Kirsty, number 10, you get to have number 10.
I think my message with this would be enjoy your dog. So you've had a diagnosis, and it can be really traumatic to take that diagnosis, but your nurse is going to help you to work through that with your veterinary team and your therapist and the support network around you. But enjoy your dog. Take them out for a walk. If they can't walk as far, put them in the car and take them somewhere. To your dog, allow them to sniff, allow them to sit in the sun. Just enjoy those moments with your dog. It doesn't matter, they can't run 10K with you anymore. The dog's not sitting there thinking about that the whole time. You might be, but the dog isn't. So enjoy your dog. Don't just see them as an arthritic dog. We can do so much to help them. We can improve their quality of life. We can get their pain under control. So let your dog be a dog, but let them do it safely.
Amazing. And Robyn, I'm going to give you an opportunity as well. Come on, you can have your final gift too, and then we'll say goodbye to everybody. What would you say to people?
Oh, it's a hard one. Give it the last one. I think I would just go along the lines with Kirsty, but also just saying that, you know, if you feel any discomfort in, if you're feeling that you're got caregiver burden, you're feeling very pressurized, just reach out to someone, because it's financially draining, it's emotionally draining, it's awful to think about that the end might be coming soon, even though it might not be, and you can't just sit there and start to feel so depressed because your dog will pick up on that.
Yeah.
So reach out to Holly's Army, reach out to Cam, reach out to your local nurse, reach out to your local vet, and tell them that you're feeling these things. And I would hope that someone else would extend their hand and help.
Perfect. I think it's a really good one to end on. So thank you guys. I just want everybody that's watched this to realise that these two people give up a lot of time to make this happen. There is a lot more to the CAM team. It isn't just a Facebook page. There is a big team of, they're basically advisors with housekeeping roles. So we have Instagram, Twitter, YouTube, Facebook. We have 4 platforms on Facebook. We have a website. We do practice trainings. We do owner workshops. We do industry consultancy. We do a hell of a lot now. We create new materials all the time. Behind this, there is an amazing group of people, and I want to say thank you to all of them for the amount of time and energy they give, and thank you two for joining us tonight. If you've got any questions, post them, because I know that Robyn and Kirsty will keep an eye on this for the rest of the evening. If you've got any questions, please just add them and we will get back to you. Other than that, your dog more years. Take care. Thank you, you two.
Bye.